Blood pressure is taken to monitor the condition of the heart. When recording blood pressure, the nurse will explain the procedure, speaking clearly, slowly, and directly, maintaining face-to-face contact with the hospital.
I'm going to take your blood pressure. You might get tight, you let me know if you feel uncomfortable.
Before using the stethoscope, the nurse will wipe the diaphragm and earpieces of the stethoscope with alcohol pads. The client's arm is positioned with palm up and upper arm is exposed. The nurse will feel for brachial artery on inner aspect of arm at the bend of the elbow. The nurse will then place the blood pressure cuff snugly on the client's upper arm with arrow over brachial artery site. The earpieces of the stethoscope are now in the ears, and the diaphragm is over brachial artery site. Candidate inflates cuff between 160 and 180. If beat heard immediately upon cuff deflation, completely deflate cuff. Reinflate cuff to no more than 200. The nurse will then deflate the cuff slowly and note the first sound and the last sound. If rounding is needed, measurements are rounded up to the nearest 2 millimeters of mercury. Removes the cuff. Signaling device is in reach of the patient. Before recording, the nurse will wash their hands.
I will now wash my hands.
After obtaining reading using BP cuff and stethoscope, records both systolic and diastolic pressures, each within plus or minus 8 millimeters of a value